Um, Alrighty, Jasmine, so I will let you take it away. Jasmine Hall is our epidemiologist coordinator over at the Office of Equity Minority Health, and she is kind of the leader of our data requests. So Jasmine, go ahead.
Thank you, Danielle. I was just going to introduce myself so we can go right to the next slide.
Right.
So we typically have data requests come through from health equity councils and BBOs so that we can connect you all with data and graphs to support implementation, prioritization, or even planning some of the efforts. And another purpose of these data requests is to facilitate the overall sharing of community level data to promote a better understanding of local level concerns and needs. We know that some of our organizations or some of our BBOs have more access to data. Some of them might have less access, but we want to make sure that you have what you need to fulfill your work. So we'll move to the next slide. So the process is fairly straightforward. We have a TA request form through Race, Equity, Diversity, and Inclusion. You can also just send me an email or send Danielle an email if you have data needs. Then we'll meet up and have a follow-up conversation to identify kind of a timeline. It might be, we might present at one health equity council. We might have to break it up over a couple of council meetings, depending on the size of the data request. So we just kind of have that follow-up conversation to kind of plan it out. And then on our end, we kind of go on a hunt. So we work with different agencies, whether it's a local health department, whether it's nonprofit, whether it's other parts of DHHS, and kind of support any partnerships as needed. I know in Macomb, we kind of made that connection to the health department for some of the local COVID data. But other times we might be connecting to different parts of DHHS, such as Medicaid or our mental health part. And then finally, we'll produce graphics or a presentation, kind of whatever you ask for as your deliverable. We produce that, we share it. If you want us to come, walk through it, we can, or if you just want us to send you a file, we can do that as well. But it's a pretty straightforward process. You can submit data requests as often as you need. You can submit a robust request. I know Nicole might share some of the pieces of hers. You could ask, one question, kind of whatever you want, and we'll try to make sure we get answers for you. The next slide will just talk about a few of the things that we've been able to produce for different councils. So we know that this grant really focuses on COVID-19. So some people want to see, how is my county doing as far as COVID-19 cases, deaths, vaccination coverage. I know we might feel like the pandemic is over with the public health emergency ending, but when you look at, for example, vaccination coverage, you'll see that in certain age groups, especially, some people may not even gotten their first dose, especially for children. So just kind of looking at what that picture might look like in your community. Life expectancy. We know that place matters. We know that we saw differences in, what COVID looked like, what different chronic diseases look like just based on where you live. And that life expectancy kind of really gives a really concise way to look at disparities, whether you're looking within your county or within specific census tracts, or even, comparing your county to the state. We look at indicators related to education, access, and quality, and kind of the different buckets of social determinants of health. Some of the education things we've kind of pulled is looking at graduation rates. We can look at quality of schools. We can look at attendance rates, things like that to kind of help, again, give us indicators for health outcomes. We can look at mental health, and this could look a number of ways. We could, look at depression screening rates by county. We can get into more minute data related to mental health utilization for some of the community resources and things like that. We have pulled census data related to transportation. So we know in the pandemic, again, it's not really over, but it's really, really odd with this public health emergency. But we know in the pandemic, people who were required to use public transportation to get to work, for example, had more exposure to COVID-19. And so just looking at how do people, get to work? What does that mode of transportation look like? Are there disparities there? Internet access and devices, access to broadband, access to computers. We can look at, what does that look like in my specific community? Healthcare access. We know having a primary care physician, having health insurance matters, and just looking at disparities there could help kind of give ideas or give thoughts about how might we as a council move forward to help reduce some of these barriers and really move toward equity. So I encourage you all, if you have not yet taken advantage of this TA opportunity, to please do. You can contact Danielle to put in your TA request, or really any one of us on the team, whoever you can get in contact with us, reach out, let us know what you need, and we will try to make sure we get that to you. So thank you. And thank you to everyone who has already used this process.
Thanks so much, Jasmine. I'm gonna pass it over to Nicole. If you want to just kind of share how the process has been for you. I know that your council has used the TA request.
Yeah, for sure. So we feel really lucky because our council is especially interested in data, and we kind of did what we could internally to provide some metrics for them, but we realized fairly quickly that we are not experts, so we should just use the experts that we have kind of at our disposal. And so we were able to get in contact with Jasmine, and what's even better about that is Jasmine's local to our community, so everybody knows her, so everybody trusts her and love her. So that certainly helps our cause for sure. But it was really great and easy. One of the first conversations we had, Jasmine actually laid out a giant PowerPoint of these are all the options that we have for data. And I'm fairly certain I only said no to like 2 items, and it wasn't even a no. It was like not as interested, but we'd be happy to look at it. So that may have been the wrong strategy for our group, because we had a fairly robust data request, but it was really wonderful because we talked through a bunch of different things. And, some of the items that Jasmine shared in particular are things that our council had discussed. So mental health was a massive component that our council has been discussing the last year. The other thing that they were especially interested in was education. So that's something they're really focused on, what's going on with our youth, how is our testing looking, how are graduation rates looking. And so that was something that I was really excited for us to be able to dig into. And the other nice thing that we did as we were kind of looking at data, Jasmine went ahead and she was able to map a lot of items. And I think visually that's very, very helpful for council members that perhaps don't live in that data space, but to be able to recognize like, hey, in this side of the community, we're seeing significant differences. I really think it helped to tie it all together for our council members. So the process is really straightforward. Again, we reached out, Jasmine sent us an enormous list of options. We said yes to almost everything. And then we actually did like a rough walkthrough of, okay, this is what we found. This is how it's looking. And I think even through that walkthrough, I was like, ooh, can we get this and that and this? So that was really exciting and fun. But overall, I think also having an epidemiologist deliver the data is really important, because our council had questions that I know I wouldn't have been able to answer just about how data is collected and where it comes from. And so being able to have an expert walk through the data, I think really helps reinforce it. So overall, I mean, I think it's a tremendous opportunity. I think everyone should do it. I say that somewhat hesitantly because I'm also going to have another data request. So get in line. But we love having the opportunity. And I think really what it did is it reinforced the fact, just like Jasmine said, we're still in a pandemic. We still have to talk about this. We still need to, be aware of what's happening, because we're not even seeing everything yet, right? It could be years before certain metrics pop out. So highly recommend the process. It was really easy and I think everyone should do it. So I'm happy to answer any questions if there are any.
Thanks, Nicole. I don't know if folks have questions about the data request process or now are interested in putting in one. I know that it's kind of a busy time during the summer, but it's just a very useful resource, and we just wanted to kind of spotlight, like I said, some of the TA offerings.
And I'll add one more thing. I think what's also nice is if you know that your council is responsive to certain types of graphics, they're pretty accommodating with how they display data, right? So is it a bar chart? Is it a line graph? Is it an infographic? Is it a map? And I think that's really important too, because every council is just a little bit different. Jasmine was able to make the majority of ours on maps, which is something that we would zoom in on. We would be like, wait, what street is that? And then like look at zip codes. So I really think it is important that if you have a good handle on how your council likes to look at things, they can be really accommodating to that. So highly recommend it.
One other selling point, and thank you, Nicole. Selling point, is that you also get to keep it. And I think I might have mentioned that, but like we send you a slide deck, we send you the sources. So like as you write for, grants or you think through your planning and stuff, you can cite stats directly. So that's another kind of neat thing.
Yeah, exactly. And there are lots of opportunities for questions, and I know they do great of following up and things like that. So I mean, it's not like, here's this slide deck and good luck. It's let us know if you have any questions, and then if there are questions, we'll follow up and make sure you kind of understand whatever that means.
Yep. And I know we during our like bi-monthlies, we typically ask kind of near the end, like, hey, do you have any TA needs and things like that? So that could be an opportunity even to just start the conversation. And then if you're like, I think this is interesting, but I don't exactly know what I want, we can schedule a follow-up and like kind of, you can look at what I presented for Macomb or for Genesee County, just to kind of get some ideas too. So we really want to encourage you and let you know that we are here, ready to analyze data for you.
So, does anyone have questions?
I will, one more thing, sorry, I'm just thinking of things. I should have wrote notes. I'm sorry, I didn't. I will say the turnaround was fairly quick. I think we had it in about a month. So we were able to plan, not like I'm saying she'll have it in a month for you, but I'm just saying it's not, my experience was we actually had a pretty quick turnaround on it. So, I don't think you need to plan for 6 months out. They can usually get it quicker than that. But it is summertime, so we'll give everyone a little bit of a break.
All right, well, I think we can pause the recording, and then if there's anything else that